So Manoj, start
Yeah,
now.
yeah. Hello everyone. Hearty welcome today to the next lecture in our series of this All About Sepsis course. As I was mentioning in the previous session, we are really thrilled and humbled by the kind of response we are getting every day in various modes from all of you and then from your colleagues who have not joined the course. So probably that shows that like we are in the right direction. We need to actually make a difference at the ground level, bridging the gap between science and practice. That's what we aim to do. And in sepsis, we have seen like being such a dynamic problem where you cannot, what is true today may not be true tomorrow. The only way to start would be probably by looking at the basics of newborn care, primary and secondary prevention. And today's topic is something in those lines: housekeeping and equipment contamination. Actually, this probably is something that's so important for all of us that I wish like this my message is percolated to all those who take care of newborn babies. To deliver today's lecture, we have a senior neonatologist from Mumbai, Dr. Anita Haribalakrishna. And to moderate today's session, we have two senior consultant neonatologists from two different parts of our country, Dr. Kamal Arora from Punjab and Dr. Jagdish Sahu from Bhubaneswar. So before I hand over to Dr. Kamal and Dr. Jagdish, let me again congratulate the whole team behind this who continue to work for this, Dr. Sridhar Sandhanam, Dr. Abhay Matthew, and the whole team of sepsis who have been doing a fabulous work, admirable work. With these few words, let me hand over the stage to the moderators for this today's lecture, Dr. Kamal and Dr. Jagdish. Over to you.
Yeah, good evening, sir. Dr. Manoj, thanks for that opportunity because I think you gave us to moderate the best session, which the most of us feel is a sister's job, staff ka job lagta hai, and it feels that maybe equipment contamination has been already been done, and we don't even check that equipment decontamination. And housekeeping, it's like a job for a sweeper or the person who is a ward boy who is working there actually. And this is so important. If I ask my colleagues also that how many times the housekeeping is done, how many times this equipment has been decontaminated, or which equipment has to be decontaminated by which thing, they will all tell isopropyl alcohol, maybe 70%, maybe something different, or everybody will have their soap and water or something cleaning with this. But exact answer they would not know because they are not doing it. So I think Dr. Anita, who is the standard of care for this and head of the department of KEM, so would be lightening us, all of us, especially the students, and even I would feel the most senior faculty would remember this, that we have to do this again and again, remember them again and again. If we do it, our staff, our sweepers, our students will follow us. So thank you, Dr. Manoj, for starting this. Actually, all sepsis, I think this is a major a problem in all of our NICUs, and everybody is afraid of this sepsis. Yeah, for a preterm baby till a term baby, sepsis and all antibiotics and irrational things, I think, keep on happening. And this topic would be a preventive topic so that it doesn't happen in our unit. Otherwise, we'll keep on finding the source of it. Dr. Jagdish, up to you.
Yeah. So good evening, everyone. Welcome, everyone. Welcome, Dr. Anita ma'am. So as Dr. Kamal has told, this is the basics of neonatology, actually, what we should be very strong upon. And that is the basis on which actually we can reduce our NICU infection rate. So there will be a lot of questions in your all minds. So let's all listen to Dr. Anita ma'am without wasting much time. And I request all of you to please listen carefully and put your questions in the chat box. And we are definitely going to take each of the questions at the end of the session. So now over to Dr. Anita ma'am, please.
Thank you, the NNF Sepsis Module team, for inviting me for this lecture, for the opportunity. I'm sharing my PPT. My screen is visible?
Yes, yes. Please go ahead.
Yes,
Yeah.
it is visible. You can start it, ma'am.
Yeah. So the topic is housekeeping and decontamination of equipments in NICU. So we'll be covering two topics, housekeeping and what is housekeeping and how do we do disinfection of instruments in NICU. Yes, the wrong side. Okay. Housekeeping encompasses maintaining a clean, safe, and organized environment for vulnerable infants and staff. This involves not just cleaning, but also infection control, stock management, and ensuring the smooth operation of the unit by coordinating various support services. Housekeeping team contributes to creating a healing environment by managing cleanliness, supplies, and logistical aspects within the NICU. This is what housekeeping means. So not only the infection control, everything of the NICU is coordinated by the housekeeping team. My screen is not moving.
Go back and see. Stop sharing and come back or something like that.
Yeah. So
Yeah,
yeah.
it is. Yeah, it is.
So now infection control. Yeah. Infection control, regular cleaning and disinfection of equipments, patient areas, and surface to prevent the spread of infection. Cleanliness and maintenance means ensure the unit is tidy and free of clutter, maintaining the cleanliness of patient areas, common spaces, and staff areas. Stock management in housekeeping means ordering, tracking, and rotating supplies, ensuring that essential items like linen, medications, and feeding supplies are readily available. Similarly, operational support means assisting with tasks like transporting equipments and supplies, and also coordinating works with other ward staffs like ward clerks. Liaising with other departments, coordinating with other hospital departments such as laundry and waste management, maintaining a safe environment, which includes identifying and reporting any potential hazards such as spills or clutter. Specific procedures, which include tasks like preparing equipments for procedures, clearing spills and disposing waste according to the hospital protocols. Similarly, collaborating with other nursing staff. We have to always, NICU nurses play important roles. We have to connect with them in all these housekeeping procedures. Then why is disinfection required? A newborn admitted to NICU acquires all skin and mucosal microbial colonization from NICU environment and mother. We know the risk factors like prematurity, feeding difficulties, underdeveloped skin barrier and immune function, broad spectrum antibiotic cover, and presence of devices. So all these places, the neonates, devices means equipments, all these places the neonates at an exaggerated susceptibility to serious infections. And we all know neonatal sepsis is the most important cause of preventable death in NICU. So what are sources of infection in NICU? So we know any lapse in the housekeeping routine and poor hand hygiene is the most important factor. Then personnel working in that unit can also contribute to infections. They can be a harbor of some organisms. Then infected newborns. Then fomites, like contaminated equipments and reservoirs. Environment per se, and also invasive procedures. These are the common sources of infection in NICU. So we can see in this diagram which are the high-risk surfaces where bacteria are most abundant. So medical charts, so the each baby's medical charts, computers where we handle daily, door handles, mobile devices. So in our NICU, everybody is having mobile. So mobile is taken inside, and it is the most important device which is inside the NICU. Similarly, trolleys, medical trolleys, mattresses, drug stations, monitors. These are the common areas which are having high risk of infection. Coming to the equipments, which are the equipments which and also room environment devices like CPAP, stethoscope, pacifier, nasal suction catheters, then isolates, ventilators, radiant warmers, room environment which include computer screen, then telephone, milk freezer handle, door handle, electronic door opener. So all these are the commonly operated devices which can harbor organisms causing infection. So we have to break the chain of infection. So we have to act at the infection agent level. So whichever bacteria, virus, fungi, or protozoal agent has to be removed from the NICU environment. Reservoirs, the people, babies, or equipments, environment which are reservoir of harboring these organisms has to be eliminated. And portal of exit, like excretions, skin droplets, all this has to be removed. Then means of transmissions, direct contacts, fomites has to be taken care of. Hand hygiene is important in this case. Similarly, portal of entry, like mucous membrane, respiratory tract, broken skin. So we have to take care of wound care, catheter care, aseptic techniques. And for baby per se, the neonate care per se can cause infection because of the sepsis. So they also have to be taken care of. So basic requirements for sepsis and NICU: running water supply, soap, elbow or foot operated taps, strict hand washing, avoid overcrowding, plenty of disposables, rational antibiotic policy, and strict adherence to the disinfection and sepsis prevention routine. Infrastructure related measures. So which are the infrastructure related measures we take? Provide at least 4 to 6 feet space in between two baby cradles. Overcrowding should be avoided. So not more than 1 or 2, one. So in our NICU setup, we allow the mothers to get inside the NICU. At the same time, father is allowed only once in a week to see the baby, or daily basis, we don't allow them because of the infection chances. So we have to prevent overcrowding. Doubling should be strictly denied in babies. So in government hospital setups, when there are a lot of babies, so in our NICU, we have 50-bedded NICU. Sometimes the NICU admission rate goes up to 80. So then doubling of the stable babies is done sometimes. So that should be strictly avoided. Air conditioner should provide at least 6 to 12 air exchanges per hour. The air delivered should be filtered with minimum 90% efficiency. So that is why the air handling unit is a very important part. The air, circulating air is very important part in NICU disinfection routine. They're taking care of that. Hand washing sink should be wide and deep enough to minimize splashing. Its tap should be elbow operated or foot operated. Besides electricity, ensure 24-hour supply of water in the NICU. Then principles of prevention of infection. Provide routine care to the newborn baby. Consider every person as potentially infectious. Wash hands or use an alcohol-based hand rub. Wear protective clothing and gloves if the risk of infection is very high in that unit. Use antiseptic techniques. Handle sharp instruments carefully and clean, sterilize or disinfect instruments and equipments as required. Routinely clean the newborn unit and dispose of waste. Isolate babies with infection to prevent spread of nosocomial infection. What are the policy-related measures should be taken? So there should be sufficient number of personnel for newborn care to prevent cross-infection. So, for example, a sick baby should be taken by care of one nurse only. So there should be a primary nurse. And at the same time, if their babies are stable, 2-3 babies can be taken care of by one nurse, not like 12 babies, 10 babies by one nurse. That should be avoided. Restrict visitors in the baby care area. Anyone, including any medical personnel with fever, respiratory infection, or any wounds, infection should not be allowed. Remove shoes and socks or wear shoe cover over there. Better to use separate slippers for NICU. So even though there is no evidence to say that there is a need for wearing, whether there is a need for wearing separate slippers for NICU, because in developed countries, they wear walking with the same shoes because the rate of infection, though they don't cause infection, because in our lower middle income countries where the rate of infection is very high, sepsis is very high, it's better to use. Gown, face mask, and head cover should be worn for any invasive procedures. Single room isolation is recommended for babies with infections like varicella and tuberculosis. NICU infection control surveillance should be in place as a routine. Culture swabs should be sent periodically. Culture register should be maintained. So procedure for entering the NICU. So allow only healthcare providers and parents. Don't allow visitors to enter into the nursery. Wear nursery slippers. This is to prevent unwanted entry of infectious agents. Remove watch and rings upon entry of the into the nursery and wash hands and arms thoroughly. Use plain or antimicrobial soap for hand washing. That is bar or liquid soap powder. Wash hands and arms at the elbow for at least 40 to 60 seconds according to the 6 steps of hand washing. So first thing is hand washing. So how do you do it? So roll the sleeves above the elbow, remove wristwatch, bangle, etc. Wet hands with water, apply enough soap to cover all hand surface, rub hands palm to palm first, okay? Then right palm over the left dorsum with interlaced fingers, then palm to palm with fingers interlaced, then back of the fingers of the opposite palm, the fingers interlocked, then rotational rubbing of the left palm clasping in right palm and vice versa. Then rotational rubbing backwards and forwards with clasped fingers of right hand in left palm and vice versa. After that, these are the steps, and then rinse hands with water. Dry hands thoroughly with a single use towel, and use the same towel to turn off the tap. Don't, after washing, don't wash. Otherwise, you can use the elbow. That's why we use the elbow operated tap. Your hands are now safe. So when you use this is for the hand washing. Then when you use the rub, when you use the hand rub, wash your hands, same thing, but wash your hands for at least 30 seconds before touching the next baby after you have handled an infected neonate. If the baby is uninfected, use alcohol-based hand rub for hand washing before touching another newborn. We can use sterilium or 70% alcohol. Note that rinsing hands with alcohol or sterilium is not a substitute for proper hand washing. If the baby is really infected and you are touching any body secretions, then you have to do soap and water hand washing. Otherwise, you do the hand washing with hand rub. Make use of single-use autoclaved sterile towel or disposable paper towel for drying the hand. Sometimes it is not available. You can use even autoclaved newspaper. That's what is used in many of the NICUs. Trim the nails and avoid nail polish. So then what are the 5 moments of hand hygiene? So before touching the patient, before any clean or aseptic procedure, then after body fluid exposure is, after touching the patient, and after touching the patient's surroundings. Now coming to disinfection routine. So what is sterilization? So I'm telling you about some terminologies. The sterilization is a process by which all microbes are destroyed, either by physical or chemical methods. Common techniques used are ethylene oxide, ETO sterilization. So in our unit, we have got a ETO in our NICU, so it's very easy to do sterilization. Then pressurized steam, then chemical agents, and hydrogen peroxide. So the common agents used. Chemicals used to destroy all forms of microbiological life is called chemical sterilants. Okay, so they destroy the spores also. Then disinfection is a process which removes majority of the microbes except bacterial spores, commonly achieved by chemical methods. So chemical disinfectants are of 4 types. They are chemical sterilants, high-level disinfectant, intermediate, and low-level disinfectants. A few disinfectants will kill spores with prolonged exposure time, that is 3 to 12 hours. And they are called chemical sterilants. For example, glutaraldehyde, if they are used for around 10 hours, if you dip an equipment in glutaraldehyde, there is Sidex, 2% glutaraldehyde Sidex for 10 hours, it becomes a chemical sterilant. Otherwise, it is a disinfectant. So now, chemical sterilants kill spores with long exposure time. Example, high concentration of hydrogen peroxide, that is 6 to 10 hours, it becomes a sterilant. It will kill the spores also. 2% glutaraldehyde, if exposed for 10 hours, it become a disinfectant, become a sterilant. 70% alcohol, if it is exposed for, if some object or some equipment is exposed for 20 to 30 minutes, it become a sterilant. 100% saffron, so for 30 minutes. So longer duration, if you use some chemicals, they become sterilants. Then high-level disinfectants kill microbes except spores. Example is 2% glutaraldehyde with contact time of 20 minutes. Intermediate level disinfectants are bactericidal and virucidal, but they are not for spores. Example are chlorhexidine and chlorine compounds, hypochlorite and all. Then low-level disinfectants destroy majority of bacteria and some viruses and some fungi, usually less than 10 minutes of exposure. So now What is a germicide? A germicide is an agent that kills all microorganisms, particularly pathogenic organisms. The term germicide includes both antiseptics and disinfectants. Antiseptics are germicides applied to living tissues and skin. Disinfectants are antimicrobials applied to inanimate objects. Antiseptics are used only on skin and not for surface disinfection. Disinfectants are not used for skin antisepsis because they can injure skin and other tissues. So basically, antiseptics are applied on the skin surface, and disinfectants are used on the equipments and other non-object inanimate objects. Viricide, fungicide, bactericide, sporicide, tuberculoside can kill the type of microorganisms. For example, bactericide is an agent that kills bacteria. So now, what is Spalding classification? So Earl Spalding devised a rational approach to disinfection and sterilization of patient care items and equipments. According to them, there are critical items, semi-critical items, and non-critical items. Okay, according to the degree of risk of infection involved in use of such items. Semi-critical items, for example, contamination of critical items can result in high risk of infection. For example, surgical instruments, cardiac implants. Okay, they are all high-risk items, so they are called critical items. And semi-critical items that come in contact with mucous membrane or non-intact skin. For example, laryngoscope blades, rectal probes. Non-critical item come in contact with intact skin. For example, BP cuff. So general instructions for using disinfectants in newborn unit. So follow the manufacturer's instruction. Check expiry date before using. So you can't use a disinfectant before checking the expiry date. And use a recommended dilution. That is also very important. It can't be over diluted. Label, and it can't be concentrated also, because sometimes it is very pungent. Label containers, date of issue and date of expiry. Empty containers after use. Wash and disinfect containers before reuse. Don't refill container. I'm telling about the container where we fill the disinfectant. Okay. Don't refill the container without disinfecting container between each use. So when you refill it, you have to wash that device and then refill it. Don't just refill it. All these are very important steps. Sometimes they can also harbor the infection, the disinfectant, if it is not kept in proper bottle. Topping up is not allowed. Don't use the same container to store other solutions. Don't leave disinfectant container open at any time. Wash and clean articles before disinfecting. So good housekeeping routine requires temperature maintenance between 25 to 28 degrees Celsius, calm and clean environment, adequate lighting and ventilation. IV sets to be changed daily. Floor should be cleaned once in a shift. 24 hours water and electricity supplied. And don't do dry disting. Don't keep any files or X-ray films on the baby's coat. This has to be strictly avoided. So good housekeeping in an ICU, each baby should have separate belongings. So each baby should have separate cot, okay, and spirit containers, measuring tapes, stethoscope, thermometer, resuscitation kit, and hand drum. Each baby cradle with a single baby should have all these things separately for each. So now coming to the, these are the basic things I want to tell before coming to the topic proper. Now coming to the housekeeping routine, floor and procedure room. So we have to clean these areas once in each. Floor should be cleaned once in each shift. And no dry sweeping with the broom. Wet mopping, we can use disinfectants. Like we can use, many of the units use phenyl or 5% Lysol. In our unit, we use 1% Virkon. Okay, or we can use 0.5% hypochlorite or 5% EcoSheet. EcoSheet is H2O. Okay, and wet mopping with mild soap solution can be done once in a week. And usually 2% glutaraldehyde is avoided in floor because it's a pungent odor. Walls also, some of them say, some of the recommendations say walls should be cleaned once daily. But previous modules used to say walls has to be cleaned in each shift. If possible, in each shift, well, otherwise, once in a day.
Can you make it in the... Excuse me.
If I make it, it is getting... No, no, if I'm making it,
Can
it is
you
getting.
make it?
Pardon? He's telling to make it in. Okay. Now it will not move. That's the problem. Okay. So then walls at least once in a day should be cleaned. Okay. So how similarly windows, doors, window sills has to be cleaned once in a shift. If not at all, if at least once in a day should be cleaned with disinfectant, 2% bacillocin. This is what we use in our unit. Or we can use 3% phenyl or Lysol or 5% EcoShield. Wet mopping with 0.5% hypochlorite can be done once a week. Okay, because these are highly used part of the unit. So walls, windows, doors, all these things has to be disinfected on a daily basis. Slipper areas. Use detergent for scrubbing and use separate brush. Every night we have to clean the slippers and slipper area. Fans once in a week with soap and water. Window AC also once in a week. We have to remove the filters and clean it with soap and water. Buckets, we have to do cleaning with soap and water in a daily shift, morning shift. Refrigerator, we have to do once in a weekly cleaning, defrost and clean with soap and water. Similarly, toilets, doors of toilets has to be cleaned with separate brush once in each shift. Okay, and then bleaching powder for decontamination once in a week. So bleaching powder or hypochlorite also can be used. Hypochlorite is bleaching powder, so they can be used once in a week. Sink that is in the NICU has to be cleaned once in each shift with detergent. Use separate brush, and once in a week we can use the bleaching powder to decontaminate the sink. Waste disposal bins has to be, so when you dispose of the waste in the bag, the bin also has to be cleaned daily. Detergent has to be used for that. Separate brush is used for all these areas. Fetal forceps daily has to be cleaned, autoclave, and should be placed in sterile bottle having dry cotton. Baby linen, wash and autoclave. Use autoclave linen each time. Steel bins to store gowns also has to be autoclave daily. The gowns used to enter inside the NICU, so there also has to be autoclaved. Now, disinfection routine of the equipments in NICU. Radiant warmer. Clean open care units, radiant warmer, and incubator every day with soap water if occupied. So if the baby is there, we have to clean with soap water. If baby is not there, and then the warmer has to be cleaned with 2% bacillocin. Thoroughly clean all the shelves. 5% EcoShield, 2% Cidex, or 3% carbolic acid may be used. So we use most commonly the disinfectant used to clean radiant warmer when not in use, or when the baby has gone out and we have to take a new baby. Do that interim period, you clean with 2% bacillocin. Otherwise, when the baby is on the cot nursing, then do soap water to clean. Then coming to ventilator. So use ventilator, all the touch areas which are commonly used has to be cleaned. No, even though they are not in contact with the baby, they have to be cleaned. Use disposable ventilator tubes, which comes already sterilized with ethylene oxide at the time of packaging. Change the tubing of the ventilator circuit in between two patients and change them electively after 72 hours of use. So sometimes people use for a week altogether the same tubings. If possible, after 3 days of use, you can change the ventilator tubings. If the tube is reusable type, then wash with soap and water and autoclave before use. You can use ETO sterilization. We in our unit we do ETO sterilization of the tubes. Alternatively, immerse in 2% Cidex for at least 6 hours. We can do that also. If ETO is not available or we can't autoclave, then we can immerse in Cidex 6 hours. That is 2% glutaraldehyde. And then taking out of the Cidex, we have to clean with sterile water and dry with autoclave linen and then cover it and then put the date and timing of clean. So once we use keep like this, then we know what is the date of autoclaving, and after maximum of 6 days, we can 3 days. Some people say, but maximum of 6 days or 1 week we can keep it. Otherwise, we have to re-autoclave it if it is not used. Change the bacterial filters of the ventilator in between use by 2 patients. Don't forget about the bacterial filters. That also has to be cleaned. Sometimes, if the residents don't clean the bacterial filters, and when the engineer comes to clean, they show us a lot of dust in the filter. So it has to be cleaned between 2 patients. Autoclave the humidification chamber used by the patient. The humidification chamber, we use a reusable type. So if not reusable, we use a disposable type. If you use a reusable type, then don't forget to autoclave. Else sterilize with Sidex also is possible. Use only sterile distilled water in the humidifier and it should be changed daily. Screen and machine. So in the ventilator, the screen should be cleaned with wet mop. We can use 2% bacillocin for disinfecting the screen and all. That is a better one because when the infection is rampant, better to disinfect rather than using soap water. Some people use soap water. Better to use a wet mop with a 2% bacillocin is the best one. Then phototherapy units and pulse oximeters, wet mop with plain water daily. So the screen has to be, cleaned with plain water. We use soap water because they are not coming in contact with the babies. We can use soap water to clean it. Humidification but at the same time, the port which is connecting to the circuit that is being commonly used, that has to be disinfected with 2% bacillocin of the phototherapy units and the pulse oximeter. I will show the video so you will understand better. Humidification chamber, sterilize the humidification chamber by dipping in Sidex for 4 to 6 hours. And this I have already told you. Then coming to the resuscitation bag and reservoirs, oxygen tubings, bottle and tubings of suction machine, face mask, all this has to be cleaned with soap water and then clean it and then rinse with water, tap water. Immerse in Sidex for 4 to 6 hours. After that, take it out and rinse in distilled water. Dry, wrap in autoclave linen, put a date. This is a common method that is used. So after each use, all these things has to be cleaned. Not like if it is not used, then you daily. After each use, we have to disinfect all these equipments. Oxygen hood, wash them with soap and water daily, once in the morning shift, and also in between used by the 2 different babies. Tie them with autoclave linen. Then coming to laryngoscope blades. So after use, remove the bulb of the blade. Okay. They wash the blade with soap and water, and you have to immerse in 2% butadiene for Sidex for 4 to 6 hours. Wash with sterile distilled. If there is no time we have to use immediately, then the blade can be cleaned with the spirit also, or sterilium also can be used. If immediately you have to use. Otherwise, we have to put it in Sidex. Minimum for 30 minutes and up to 4 to 6 hours you can keep. But it's recommended is 20 to 30 minutes. Wash with sterile water after removal from the Sidex, dry it with autoclave linen and wrap it in an autoclave and don't forget to put the date and time of autoclaving. So that I told you, in case of emergencies, we can clean the spirit of sterilium. Then stethoscope, then measuring tape, okay, then BP cuffs, radiant warmers, then vital sign monitors. All these things has to be cleaned with a spirit or sterilium daily, once in the morning shift and also in between used by 2 different babies. Weighing machine should be cleaned daily with disinfectant, that is 2% bacillocin to Sidex. Use separate sterile paper for each baby at the time of taking weight. So when you put the baby on the weighing machine, don't put on the bare weighing machine. Put some paper and you initialize it at 0 and then take the weight of the baby. And all these things has to be sterilized, disinfected with a common disinfectant, like 2% bacillocin is enough. Thermometer, there should be separate thermometer, I told you, for each baby. It is wiped from bulb to base with spirit or sterilium daily once, and store in a case containing dry cotton. Then procedure sets and instruments. Soiled instruments should be washed with water and then dried and then wrapped in linen and then autoclave these items. And after each use, they have to be autoclaved. And if it is not used, kept it autoclaved, and if it is not used for 3 to 6 days, then re-autoclave. Cheetle forbs should be autoclaved daily, and it should be kept in a sterile autoclaved bottle containing sterile dry cotton. So the cotton also has to be autoclaved. I have to keep inside the bottle for cheetle forbs and also for the thermometer. Kidney trays should be either autoclaved daily or immerse in 1% hypochlorite solution for 30 minutes. Then swab kidney trays we normally use to keep the after putting the IV line or any procedures we do, we use it kidney trays, so it has to be disinfected. Swab containers and injection trays also has to be cleaned with soap and water once in the morning shift. Feeding utensils. So wash with the feeding cups, and so we use a vati spoon for feeding, or we can use a bondla or paladay. Also, some of the units use. Or this has to be cleaned with soap and water, and then boil for 10 to 15 minutes. And after boiling for 10 to 15 minutes, the feeding utensils has to be taken out in a very aseptic precautions. We're using digital forceps, and it is kept in the hot air oven for drying, and then take it out for using. If hot air oven is not available, then can air dry it and use it. Use disposable feeding tubes. Okay, indwelling orogastric tube should be changed once in 24 hours. So now coming to the baby blankets and baby linen, they ensure each delivery of the clean linen contains sufficient. There should be enough linen for 8-hour shift. The linen and cotton used in the NICU should be clean and autoclaved. And if the linen is contaminated, then you have to immerse in 5% chlorine solution for 10 minutes to decontaminate, and then release in cold water and dry in the sun and autoclave. We use autoclave linen in NICU. So I told you cotton gauze has to be autoclaved daily. Wash every day the swab containers, injection and medication tray. Use separate swab containers for each baby. Autoclave steel drum after use. So the drum which we use for autoclave, that also has to be autoclaved. And rubber articles are also autoclaved. So normally we use a disposable gloves. We are not reusing the gloves. But if you are reusing the gloves, then it also has to be autoclaved. Then furniture in the NICU. So a lot of kangaroo mother care chairs in NICU, or other the doctor's seated chair or tables. Wipe the dust on furniture using piece of dry, clean, soft cloth daily, followed by damp dusting. So any water chemicals has to be wiped off to avoid stains and damage, and disinfect all these with with common disinfectant. You can use 2% Savlon or 2% glutaraldehyde. Trolleys, lockers, IV stands, examination tables, they all have to be disinfected daily. Don't forget all these items. Then coming to the more controversial topic of fumigation, whether to do or not. So routine fumigation does not offer any advantage over and above the good housekeeping measures. If you're doing good housekeeping measures in your unit, then there is no role of fumigation. Fumigation of the NICU is done if air sampling cultures are positive or if there is an outbreak. This may be done, the fumigation can be done with either 20% echo shield, that is 1 liter 20% solution for each 1000 cubic feet area, or 40% formalin can be used, that is 30 ml formalin, 40% formalin added with 90 ml of water for 1000 cubic feet area. Formalin is very irritant. The advantage of echo shield is that it is not irritant to the eyes, so better to use echo shield. NICU has to be sealed properly for at least 6 hours after fumigation with formalin, and for at least 1 hour with echo shield. Because why? Because it is very pungent, no? That's why. With echo shield, only 1 hour is required. So these are the things I told you. The same in table format. Feeding utensils, I told you. Nothing is left. This is in table format. So rectal probes, similar to laryngoscope blades, rectal probes also has to be cleaned with 70% isopropyl alcohol. Incubators also I told you. So incubators also like Redin warmer. Daily basis we have to wipe with the soap water. Baby is occupying that incubator. We have soap and water. We have to clean the area. If you are removing the baby after 14 days, no? So after 1 week, take the baby out, and then we have to disinfect the area with 2% bacillus. Similarly, scalpel blade, central line, PIC lines, all these are single-use items we use. So that is a better one. One more thing is 2D echo transducers. So currently, POCUS is very, very hot topic. Everybody is doing POCUS. So don't forget to clean the areas. So after each use, we have to clean the probe also. So alcohols are often contraindicated for that probe, 2D echo probe, because of the material incompatibility. We can clean the area with disinfect with ethylene oxide gas, hydrogen peroxide gas plasma, and liquid chemicals with the extended glutaraldehyde. So these are common disinfectants you should know how to prepare. Virkon, 1% Virkon, add 10 gram of Virkon powder to 1 liter of water. It is normally used for floor cleaning in our unit. If it is not available, I told you we can use other disinfectants like Lysol and phenol. Okay, then 0.5% hypochlorite, sodium hypochlorite, one of the wonderful agent as a disinfectant. Add 500 ml of hypochlorite to 10 liters of water. Okay, it is commonly used. 2% neutraldehyde is also commonly used. So add 200 ml of Cidex with 1000 ml water. EcoShield that I told you for fumigation, 200 ml in 800 ml water. So this proportion of these agents has to be properly done. Otherwise, there is no, if it is over diluted, then the effect won't be certain. And use separate plastic buckets for housekeeping routine for each section. So soap and detergent. So in nutshell, soap and detergent is used for wash basins, sinks, fans, windows of air conditioners, refrigerators, buckets, dustbins, slipper areas, swab containers, injection trays, oxygen hood. Spirit is used for preparation of skin, laryngoscope blades, stethoscope, measuring tape, thermometer. Also probe, any probes like rain warmer probes, pulse oximeter probes are also clean. Sterilium, 2%. There is 2 propanol, 1 propanol, ethyl hexadecyl dimethyl ammonium ethyl sulfate. Okay, so it is basically used for disinfection of hands. Sometimes immediately we have to disinfect laryngoscope. We can use that. Stethoscope, measuring tape, thermometer also disinfected using sterilium. Spirit or sterilium we can use. Cidex, this is made by adding, I told you, if it is 2.25% Cidex, then 225 ml to 1000 ml water. 2% is 200 ml to 1000 ml water. Once made, the solution remains active for 14 days. Contact time for disinfection and sterilization is 20 minutes and 4 to 6 hours respectively. So what are the agents what are the items which we disinfect with Cidex? Face mask, resuscitation bag, reservoir, ventilation circuits, suction bottles, humidification chamber, weighing machine, laryngoscope blades, okay, surface of incubator, and warmers. All these are high touch surfaces. That's why they have to be disinfected. EcoShield. EcoShield is 11% hydrogen peroxide with 0.01% silver nitride. So it is 20% solution is used for fumigation in NICU. Okay, and 5% solution is used for wet mopping of floors, walls, and surface of incubators and walls. 40% formalin is used for fumigation. 7.5% povidone iodine, that is betadine, is used for skin preparation. Bleach solution is 1% hypochlorite, sodium hypochlorite. Sharps, needles, kidney trays has to be put in the bleach solution first, and then Savlon, it's cetrimide solution, chlorhexidine glutamate, and isopropyl alcohol in a concentration of 15%, 7.5%, and 7%. Suction bottles. To fill the suction bottles, we use Savlon. So suction tubes, we put it in the Cidex, but suction bottle also has to be clean. So Savlon is put it inside the suction bottles. Then carbolic acid, 3% for cleaning of surfaces of incubators and warmers and drains. Phenol is also used as a floor disinfectant, and Lysol also. Now coming to biomedical waste management, any waste which is generated during the diagnosis, treatment, or immunization of human beings, okay? Any biological materials or testing of biological materials or health camps, they are all biomedical waste. 85% are non-hazardous. 5% is non-infectious hazardous. 10% is effective. Yeah. So generation of biomedical waste to be segregated and pre-treated, and they are collected in a segregated waste from different areas of the hospital, stored and transported. So now you should know the color category. There is yellow. So yellow is used for any human and animal anatomical waste, soil waste, such as dressings, swabs, blood bags, okay, expired or discarded medicines, okay, discarded linen, and mattresses contaminated with blood and body fluids, microbiological waste like live vaccines, culture devices. So all these biological materials which come in contact, they have to be put in the yellow bag, and each item has to be disposed. Incineration is most commonly used. Then red coated bag is used for contaminated waste like tubings, IV sets, catheters, gloves, syringes, vacuum containers. All these things come in the red bag. And they are also disposed by autoclaving, and then plastic waste should not be disposed in landfills. They are shredded. White sharp needles, scalpel blades on this are disposed in the white colored bins. And treatment and disposal is by autoclaving or dye sterilization, and then they are finally disposed in the landfills. The last one, blue, it is puncture proof and leak proofs. Metallic body implants, glassware like medicine vials, ampules put in the blue. So they are also disinfected and then claimed from hydroclave. So one thing I want to tell you is when you use POCUS, unsterile ultrasound gel can be a potential source of infection. There is a case report says that ultrasound gel has a source of Burkholderia separatia sepsis outbreak in preterm neonates. So don't forget to disinfect the area and don't use alcohol wipes also. Surveillance in the NICU. So this also one of the controversial topics. When do you need to do surveillance? Surveillance is a monitoring of the infection in the unit, monitoring of the antibiotic use and resistance, conducting periodic survey to identify unusual pattern of flora and infection. Positive culture is reviewed every 4 to 6 months based on which the antibiotic policy has to be changed. So how frequently should surveillance be done? So some NNF guidelines say there's no need for routine surveillance. Only when there's an outbreak, we should do surveillance. But in our NICU, because of the infection rate, so when the sepsis rate is more than 30%, both early and late on sepsis, 30% or more, then it's better to do routine surveillance because we get a lot of outbound admissions. So we do, so what we are doing, I am telling you, but what NNF recommendation says, I will come in the next slides. Room air is weekly. Surfaces like laminar flow, warmer, incubator, trolleys twice weekly. Then equipments like laryngoscope, ambu bags, mask, stethoscope, oxygen hood, BP cups twice weekly. Liquids like water and humidification bottle every fortnightly. Then blood CSF culture whenever indicated, pus culture whenever present, and personals, hands, nasal, throat swabs as required. So what the NNF recommendation says. So asepsis should be maintained during the birthing process by following the clean birth practice, strong recommendation. But all of them have very low certainty of evidence. Hand hygiene should be either by hand washing or by using alcohol-based hand rub. There is strong recommendation, very low quality evidence. Hand washing should be followed at the time of entry to the unit or when hands are visibly soiled. The strong recommendation, moderate quality evidence is there. Then aseptic non-touch technique should be followed during invasive procedures like central or peripheral vascular cannulation, intravenous fluid or medication preparation or administration, like when you use in laminar flow, the endotracheal tube insertion or suction. So this is a strong recommendation and moderate quality evidence. Neonatal unit should implement central line insertion and care bundle to reduce catheter-related infections. That is high quality evidence is there. Then neonatal unit should implement ventilator-associated pneumonia prevention bundle in neonate on invasive and non-respiratory support. It is not graded, but it is strongly recommended. Regular educational activities about prevention of healthcare-associated infections should be conducted for healthcare professionals. Optimum nurse-patient ratio should be ensured in neonatal unit to prevent healthcare-associated infections. Regular antibiotic stewardship program should be implemented in neonatal unit. It is also moderate quality evidence. Then routine environmental surveillance cultures should not be done in neonatal unit. Surveillance cultures should be taken only for outbreak investigations, specific research question, potentially hazardous environmental condition, and quality assurance of a sterile process. It is not graded, but it's strongly recommended. Routine organism-specific surveillance is unlikely to be beneficial in overcrowded and busy facilities. It may have some utility in setups with adequate isolation and lab facilities. It is a weak recommendation. So these are the basic important recommendations set up by our National Neonatology Forum for disinfection routine and surveillance also. So now I'll show you one video. It's a wonderful video. So if you are not able to, can you hear the can you hear the noise, Dr. Ebi?
No.
You can hear?
Not able to hear.
So before entering the NICU, we have to remove so all the accessories has to be removed. The cap has to be worn in. The nails, you can see the nails is trimmed and cleaned. And then it is better to cover the foot area with the cover or use separate slippers and then do the hand washing. All the 6 steps of hand hygiene has to be done. So you can see what are the steps of hand washing. So you can see it nicely. So all the 6 steps of hand washing has to be done. After that, you have to wash, and you can see after washing, she's using the elbow and taking the apron to wear inside the NICU. So you can see the NICU is not a busy place. It's not overcrowding is not there. Only 1 or 2 person are there in the small unit though. Any person with infection, conjunctivitis, diarrhea, URI should not be allowed to enter the NICU. Avoid overcrowding is must to prevent infection. Any hospital personnel who does not have a valid reason to be in the unit should not be allowed to enter. So some other person is coming, the person has to do the same steps before entering the unit. So you can see the baby is being so it's someone kangaroo mother care. So how the baby is wrapped and how the baby is weighed, you can see. So how the feeding is being given. Okay. So this is the mother, and the nurse is telling mother what all things she has to do. Now how to clean the floors and walls of the SNC. So you can see no dry mopping is done. Always wet mopping is done. So both walls and floors has to be taken care of. The unit, see that the floor of the NICU has to be very tiled, and there should not be any breaks in between the tiles. It should be clean tiles to prevent growth of organisms. And for the floor cleaning, we should have 3 different buckets. The first bucket is plain water. Second bucket is a disinfectant, and third bucket is the empty bucket where you put the dirty water. So when you mop also, only 1 time mopping is done. Can you see that? Yeah. So this is the plain water. This is the disinfectant, second one, blue one, and third one is the dirty water which we pour after the floor is cleaned. So the person is first dipping in the plain water. Okay. And then we will dip it in the disinfectant solution. And then mop the area. So you can see only one mopping is done. Once mopping is done. It's not double mopping. Once mopping is done. And then the dirty water is poured in the red bucket. And then again, it is dipped in the plain water to clean. Okay. So this is a method of both for floor cleaning and also for the wall cleaning. High-touch surface should be cleaned with surface disinfectant. So like the printer, the laptop, everything which is in the NICU area should be cleaned with the surface disinfectant. Now how to clean a radiant warmer? We shall learn how to clean the radiant. So the top surface of the radiant warmer also has to be cleaned. The control panel of the radiant warmer and also bassinet, they are high-touch surfaces. Okay. So they need to be thoroughly cleaned and disinfected. So they are using a surface disinfectant, 2% bacillocid to clean it. Or we can use soap and water at least once a day. When a warmer bed is empty, then there is no need for soap and water. We can use surface disinfectant individually by using a disinfectant, that is 2% bacillocid. Don't use alcohol-based solution to clean the transparent panels. So you can see this temperature probe has to be disinfected using 70% isopropyl alcohol at least once a day. The sides of the bassinet and the bedding has to be cleaned daily. Yeah? The baby has to be lifted out on the bed and then cleaned with soap and water. If baby is not there, with bacillocid. Then how to clean the resuscitation equipments? Mask, reservoir, oxygen tubing, laryngoscope blade. All these parts has to be dismantled. They have to be thoroughly cleaned in soap and water. And then after that, rinsed with running water. It is done at least once in a day or after each use. After cleaning, then so you can see the laryngoscope blade, the battery has to be taken out. From laryngoscope should be washed with soap and water initially. You see the battery is removed out. After cleaning soap and water, you have to immerse these items in 2% glutaraldehyde or side solution. Laryngoscope parts are immersed for half an hour, while others are immersed for 6 hours. When suction tubing will be immersed. After that, after immersal for the recommended duration, they are taken it out and then washed with water and dried. We have to keep a sterile tray. After drying them, we have to wrap these items in a sterile sheet, and then we have to keep it put a date and time of doing that and use for keep it for the next use. In emergency situation, when thorough cleaning is not possible, we have to wipe the surface of the mask, patient end of the bag, and the laryngoscope blade thoroughly with 70% isopropyl alcohol, and then use. Now, how to clean the suction machine? So we have foot operated machine and also electrical machine or central suction. They have two main parts which should be cleaned. One is a suction jar. It is made of plastic or polycarbonate. The next is suction tube. It is made of plastic. The suction jar should be emptied and cleaned with soap and water. It should be done at least twice a day. Or when it is full, you have to empty it and clean it. It should be cleaned with water and detergent and rinsed thoroughly with running water. The sterile suction tubing should remain inside the packet and only end is connected to the suction jar. Suction tubing should be washed with soap and water. And then it is dipped in 2% glutaraldehyde for 30 minutes. This is done every day. And then it is taken out and rinsed with sterile water and allowed to dry. And then you have to pack it and use. On a new baby, the suction tube has to be changed for each baby. Then how to disinfect the pulse oximeter? So you can see pulse oximeter has following different parts: power cord, extension cable, sensor probe, which is connected to the baby, main screen, display panel. Parts of the pulse oximeter. All these parts are high touch surfaces. They have to be disinfected daily. Always shut off the pulse oximeter and power cord has to be removed before disinfecting the pulse oximeter. We have to power cord and extension cable has to be cleaned with surface disinfectant containing glutaraldehyde or 2% bacillocid. Clean the main screen with soap and water. Sensor probe has to be cleaned with 70% isopropyl alcohol. And always remember to clean the buttons also and screen also if it is a touchscreen device. It should be cleaned at least once in a day. And whenever attached to a new baby or a new site, it has to be cleaned. Now, how to clean the feeding utensils. So, feeding palade or katori or cup should be made of easily used material, that is stainless steel. They should not be having any grooves or ridges so that any bacteria doesn't stay inside. After feeding, the palade and cup should be washed in soap and water for initial disinfection. So after that, after washing in soap and water, they have to be boiled for 10 to 15 minutes. We have to use the cheetle forceps to put inside the boiling water 15 minutes. And then we have to take it out after 15 minutes and kept inside the hot air oven for 20 to 30 minutes. The utensils are taken out for use after that. This is a hot air oven. If hot air oven is not there, then we have to allow the utensils to air dry. Now, how to clean the phototherapy units. Phototherapy units should be cleaned every day, okay, and prior to use on a new baby. So you can use surface disinfectant. You switch off the phototherapy unit before cleaning to avoid any risk of electrical accidents. The entire unit has to be cleaned, including the area with the lamps. They are cleaned with the damp cloth with soap and water. We can use surface disinfectant like 2% bacillus or butyrhaldia to clean the machine. The whole area has to be cleaned. The frequent touch surface like the switches, control panels has to be disinfected with the surface disinfectant. Okay. So that's all about the video. So this is credit goes to Dr. Sushma Nangia madam. So Lady Hardin Medical College for the same. So now key points. So basic measure that we have to take is hand hygiene. Don't keep formites like case files, X-ray, etc. on the baby coat. Personal clothing and unscrubbed areas of skin should not be touching the baby. Wear face mask and head cover while handling units. Baby should be nursed on autoclaved linen. Use disposable cord clamps or autoclaved cord ties. Clean each eye daily with separate sterile gauze piece soaked in sterile normal saline from medial to lateral side. Always use sterile gloves for invasive procedures. Label IV fluid bottles with date and time of opening the seal. Once opened, they should not be used before 24 hours. IV sets and ports should not be left open. Antibiotic vials should change every 24 hours. Kangaroo mother care given in very low birth weight babies has been shown to decrease the risk of nosocomial infection. This is our unit 2 days back where we are giving kangaroo mother care for most of the babies in the intermediate care unit. So this is a high recommendation for reducing the nosocomial infection. So these are my references, and thank you.
Thank you so much, ma'am. So now we'll open it for the question and answer session.
Yeah.
So I'll just go through the questions what is there in the chat box. So actually there are a lot of questions has been asked. So just I'll go one by one.
Okay.
So, ma'am, Dr. Abhishek Paul is asking how
Okay.
frequently to disinfect the equipments in the NICU.
That I told, na, daily all the equipments has to be
Yes, ma'am.
disinfected. Yeah,
Yes,
no
ma'am.
doubt about it.
Yes. So another question is from Dr. Kumari Pratima. What culture to be sent routinely as a part of NICU sepsis surveillance and at what interval?
So as per the NNF recommendation, there is no role of sending routine surveillance. If there is an outbreak or you think that the infection is on the rise, then you can send the surveillance of, I have told you enlisted the list, air, then the different items in the NICU, and then surface swabs, all those things has to be sent. All those details I have sent in the slide also, you can see, go through. So even the wash basin, everything has to be, even the breast pump, all those things in the NICU, all this has to be sent for. If there is an outbreak, otherwise no need.
Regarding which agents can be used as a virucide, fungicide, and tuberculoside?
Normally surface disinfectants like 2% glutaraldehyde, EcoShield,
Yeah.
all they are very commonly used as a fungicide and bacteria. They are very good agents. Yeah.
Again, another question somebody has asked is, what is the soap that has to be used? You mentioned about soap and water. So which soap to be used?
We can use any normal routine soap, or there is no specific soap used. Yes, we can use any soap. Yeah. There's no any brand name. Yeah, any soap can be used.
Yeah. Regarding the cleaning of laryngoscope, you told that you have to remove the bulb. So, the question is from Dr. Thomas is, what about the cleaning of the ball of the laryngoscope? So how you disinfect it? Because that is most contaminated.
Spirit. We can use spirit, na? Spirit or 70% alcohol. Yeah.
Yes. Another question is regarding the hand dryer. So Dr. Karthikeyan is asking, hand dryer is discouraged after hand washing. What is the best alternative for drying hands after washing in a low resource setting?
In a low resource setting, I have seen in Madras Medical College. I have gone to Madras Medical College. What they are using, Kumta Madam has started that. What they are doing is, they are using autoclaved linens. There are around 20-30 linens in each unit. They are using the same linens, autoclaved linens, for drying the hands. It's the best method we can use.
Yes. We also use at AIMS Vanessa the same thing.
Yeah.
Just, we have made just like a handkerchief and we do it regularly.
Yeah.
And I have seen actually in some units, they are using autoclaving the newspapers. Can you
that
comment
also is
on
it.
that?
I think in our unit also, we used to use autoclaving, but after JSSK we get the tissues, sterile tissues, so we use that. So
but
previously
there
we
was
also
an
used to
issue
use
regarding the lead.
Yeah.
Lead in the newspaper. My infection control unit, they raised an objection regarding the use of that lead ink.
That's why we are similarly.
That's why we
But
have
there is an
stopped that
autoclave
and
linen,
we
you
use
know.
it.
30 people are there or 50 people are there, use 50 linens, and then you continue to autoclave. That is the best alternative.
Yes.
Yeah.
Yes, sir. Ma'am, I'm just asking Dr. Kamal, are you there? Dr. Kamal? Hello, Dr. Kamal? Actually, okay. So going to the next question, ma'am. So regarding the OG tube, so how frequently you should change the OG tube? Is it for every 24 hours?
Yeah, actually, every 24 hours is what is recommended. But at least once in, once in a week, at least it should be, week is too much. Once in 72 hours, we can remove it. We don't remove daily, but it comes out. So that is another thing.
Baby removes it, yes, ma'am. Okay.
So once in 3 days at least, yeah.
Can Dr. Suchitra is asking, can liquid hand wash be used instead of soap?
Yeah, we can use. Yeah.
Yes, ma'am. Another thing, Dr. Prachi is asking about cleaning up eco probe between the babies in a BG unit.
Yeah, eco probe, as I told you now, we can't use any spirit or isopropyl alcohol. We can't use. So we can. The only thing we can use is clean with like a glutaraldehyde. That is one thing we can use for eco probe. Otherwise, ask any surface disinfectant. They tell when you go to when you buy the equipment, they ask the same question. They tell any surface disinfectant that is used in the unit can be used, but don't use spirit or alcohol. You can use bacillocid or we can use glutaraldehyde. Yeah.
Ma'am, can we use that betadine solution or chlorestine solution for cleaning this probe surface?
I'm not sure about it. I have not seen that being used. I'm not
I
sure.
have seen in some units using the betadine also, but I am not sure.
But we don't use betadine because whether it will damage the prop, you have to ask the particular,
Yes,
the company and then do it, because some of the props. Anyhow, the one thing is you can't use spirit or this thing.
Yes, ma'am. Spirit
yeah.
should be happened.
Yeah.
That damages the piezoelectric crystals and all. Okay.
Yeah.
Dr. Kumari Pratima is asking, in case of centralized AC, how frequently to clean the AC vents?
Actually, we also have centralized AC. So in our unit, what they do, it is not possible to clean on a daily basis. But what they recommend is if it's a split AC, you can clean it in a weekly basis. But if it's centralized unit, monthly basis is what is recommended. But if it is not monthly, at least monthly has to be done. So in our unit, we do it 3 monthly. Means 4 times in a year only they do it. But it depends on if they are doing it monthly, at least monthly should be done, if feasible.
So, yes. Dr. Kavita is asking, so regarding use of gown while actually examining the babies, should the sister feeding the baby change the gown before feeding the next baby?
No. Actually, the use of gown is also not mandatory. So some units are using gowns. In many units, so I was trained abroad. So there, we don't use gown for only for procedures. We used to wear gown. It is not mandatory. So gown is just to
If the baby is infected, suppose we are dealing with an infected baby, culture positive baby, then we can use it. Otherwise,
it is not necessarily. But if she is going into the isolated baby or infected baby, and then she has to remove the gown. And, Any other questions?
Yes, ma'am. Yes, ma'am. So there are so many questions as I am going one by one. How to clean the central line area and endotracheal tube area to maintain asepsis, and how frequently ET tube and central line to be changed?
Actually, ET tube should not be changed unless indicated. Because there is, if the baby is having any issues, like you feel that the baby's tube is blocked or if you need to change, then only you should change ET tube. Otherwise, there is no need to change the ET tube every weekly or something. So in if the infection rate is high and if the baby is having VAP, then definitely you may have to change as per the requirement of the baby. Baby requires it, and if the gas is abnormal, then you change. Otherwise, there is no indication for changing the ET tube on a regular basis. And similarly, central line, once you put, you can use it for around a period of 6 to 8 weeks if proper care is taken care of. So we have to once you put the central line in a baby, you take care of the aseptic precautions and put the central line, and then you put a tegaderm over that. That area has to be that area is already sealed and it is sterile, and that has not to be breached. That care has to be taken care of. Otherwise, some people put a betadine gauze and all those things. That is not required actually. Only thing is that area has not to be soiled. If blood is there, for example, if the central line is put, like if you put a 2 French PICC line, and then if there is a blood stain, then that blood stain has to be cleaned. That is, tegaderm has to be opened, and then with sterile aseptic precautions, and the blood stain has to be removed, and then put a new tegaderm. That is required. Otherwise, you can keep it for 6 to 8 weeks.
Yes, ma'am. Regarding the central line, can you just specify regarding how frequently, what should be the ideal time when we should remove a UVC line or PICC line?
Yeah, umbilical arterial line, keep it for 3 to 4 days. Umbilical venous line, we keep it for 7 days, maximum up to 10 days. PICC line, we can keep it for 6 to 8 weeks. And then if you put a central line on the neck, you can keep it for 6 to 8 weeks.
Dr. Ashish Dikit is asking, with baby on cot, how frequently it should be cleaned? So the cot, cleaning of the cot in a warmer, baby is in the warmer, how frequently you are going to clean the
There's no need for separate cleaning of the, there's no need for separate this thing. Initially, when you, cord has to be kept just like that. It will dry and it will fall off. There's no need for separate cord cleaning. There's no need for putting any powder or anything. It will come out of its own. It don't touch on anything.
Okay. Ma'am, regarding the side wall of the warmer, that basinates, even if the baby is on, do you want to just clean it regularly or we don't need it?
Actually, when a baby is inside the cradle, you can use soap water solution to clean areas. All the areas has to be cleaned. The soap water, you can kick the baby on the hand. I showed in the video. You take it in the hand, and then you can clean the all the areas can be cleaned with soap water. And if the baby is out from the cradle and if the cradle has to be used for a new baby, between that you use a surface disinfection and clean it.
Yes.
Yeah, daily basis it has to be cleaned. Yeah.
Yes. So, Dr. Kamal, are you there? Can you just take some more questions for ma'am? Actually,
I think he's not there now.
Yeah. Okay. So going back to the next questions. So there is an interesting question regarding bathing of the babies in the NICU. So what is your
Nice,
recommendation?
Recommendation, actually any term baby, term baby can be actually bathed after 6 hours of life, 6 to 12 hours of life later, you can bath. Actually, in abroad units, they bath the baby after 12 hours. 6 to 12 hours later, they bath the baby. What we do is in all babies, preterm babies, we do sponging. Use a clean water and sponge the baby after 24 hours of life on a daily basis, once. There's no need for bathing. Putting in the swimming pool is not possible. Can use sponging after 24 hours of life.
Yes, sir. So, ma'am, another question from my end actually. So when we are discussing about bathing, so do you recommend chlorhexidine? Sometimes some unit chlorhexidine, they clean the baby with chlorhexidine solution when there is an outbreak in the NICU to decrease the colonization. So do you recommend that?
Actually, it is being done abroad actually, but not chlorhexidine bath is given in when there is an outbreak and all. Chlorhexidine is, and even for preterm, in preterm, not extreme preterm, for preterm and other babies like more than 28 weeks, chlorhexidine swabs, we use spirit and betadine, isn't it, for cleaning the areas. For any IV lines, they use chlorhexidine swabs. So that means that it can be used. Actually, it can be used. Yeah.
Okay. Another thing regarding bathing of the preterm babies. So daily, every day, whether you go for a routine cleaning of the babies, these ELBW babies or the preterm babies in the NICU. So regularly,
if the baby is in incubator, we have incubator. So in the incubator, we can't do it. Otherwise, if the baby comes out of incubator after 14 days, you can do daily cleaning. Yeah.
Yes, ma'am. No, why the question is asked actually, because most of the areas we don't have incubator in SNCU. So we have mostly the warmers, and we are recommending oil application daily to the preterm babies. So we are applying oil everywhere. So whether we want to just give the baby a cleaning bath daily so that the baby will be comfortable.
So actually now, skin maturity takes around 10 to 14 days. So we can, for extreme preterm less than 28 weeks, we can wait for that 14 days time to do the bathing. If you are not in the incubator, like maybe it's 500 gamma, 600 gamma, then we can wait for the baby to stabilize for 2 weeks and then you start sponging the baby. Otherwise, any baby more than 28 weeks from day 2 of life, you can do this sponging the baby. Yeah.
Yes, sir. Yes, sir. There is a question from Dr. Tohit Iqbali. So regarding wearing the gown in the NICU, is it recommended? Wearing gown in the NICU. It
is not recommended. Actually, many units, they are not wearing gowns unless there is a procedure. I told you previously also. Yes, unless there is a procedure we are going to do, which requires aseptic precautions, actually it is not indicated. There is no evidence for that. But if the unit is following the policy of wearing the gown, so a person is coming, for example, a busy unit like ours is a very busy unit. We have around 10 to 15 admissions per day. So, and then you are going after babies, better to wear an apron over that, so that but it is not going to help. So it is not recommended.
That's my answer. With what is your take on regarding use of cap and mask in the NICU? Sterile cap and sterile mask in the NICU?
Actually,
is it unit to unit or it is a universal indication?
No, it is not a universal indication. The cap and mask. If the area, but one thing I want to make clear is that if that NICU is a high septic NICU, like NICU, some units have high rate of sepsis, like more than 40%, 50%. Even using slippers also. It depends on how much is the incidence of sepsis in your unit. Otherwise, there is no evidence to say that you have to wear apron, you have to wear slippers, you have to wear mask or caps. If the incidence of sepsis is very less in your unit, then there is no need. But at the same time, if your unit is having high rate of sepsis, more than 30%, cut off if you take 30%. 30% I told because less than 30% it is controllable. More than 30% is not controllable. So in that case, you better to wear all these extra precautions. But it is not indicated. Yeah.
So another question regarding the body wash. So how frequently to give body wash for babies, and is sterile moist cloth is enough?
Yeah, that is enough. Sterile moist cloth is enough.
That's enough. That you have already answered.
Yeah.
So Dr. Jeepak is asking, can you tell something regarding the HME filter used on ventilator tubes and also how to clean the filter of a ventilator?
Yeah, actually, HME filters has to be taken care of. It has to be what we take is we take it out. We have to initially dry it. clean it with a dry towel so that all the impurities are gone from that. And this filters has to be, what we do is we do ETO. We put it in the ETO and sterilize it. ETO sterilization is one of the methods we can use. We can't put it in glutaraldehyde, or we can't put it in any other solutions. It can damage it. So ETO sterilization is one method which can help to save that HME filters. Or we can, if it is not possible, then we can use a bacillocid to clean that area.
Do you actually use HME filters in newborn ventilations nowadays?
Filters, HME filters we don't use actually, but yeah, we don't use it
because
currently.
For carbon dioxide retention, usually we don't use it. Usually the respiratory acid has a filter that has to be changed.
We don't use it. We don't use it. Yeah.
Okay. So Dr. Satyajit asking, how frequently these ventilator circuits and oxygen tubing should be changed? It's a very practical question.
Ventilator circuits
and the oxygen tubings.
Actually, oxygen tubings and ventilator circuits has to be actually cleaned on a daily basis. And tubings for a baby, I told you previously also, if possible, you can change every daily if you have surplus amount of tubings. Otherwise, the same tubing can be used up to a maximum of 7 days and then change the tube. That's what I will answer for Indian scenario.
But for ventilator circuits, it is too costly. So for every day also changing it is difficult.
No, we can change the tubing. We can reuse the tubing. If it is a disposable, it is difficult. But if it is a reusable tubing, we can change after 7 days. But that is what is recommended. We are not doing it once it is attached to the baby. We are not doing it actually to prevent infection and also to prevent VAP and all those issues. We have to change it after a week's time. That's what is recommended.
Yes. So we used to actually change only when it is visibly soiled, or else we used to continue it.
So we don't have that surplus amount now. That's
right. Unless it is visibly soiled, contaminated, we don't change that routinely actually.
Yeah.
Oxygen tubing, definitely, yes, we do it every day.
Yeah, it's possible. Yeah.
Because it is easy, it is cheap.
Yeah, it is easy, yeah.
Then, yes. So there is Dr. Sridhar sir has put a point. There are some studies from the 1990s showing that gowning may increase the nosocomial infection rate. So it is not routinely recommended, except for contact isolation, what Mama has already discussed that.
Yeah.
Yes. So how to clean the embrace warmer? So Dr. Sahana is asking. So embrace that we are using now for the transport of the babies. So how to clean that?
Actually, embrace warmer, we can actually do the surface disinfectant and clean it. Local like bacillocid we can use and clean it. That's what we can do. Else it is not possible. Any surface disinfectant we can use. We can use glutaraldehyde also. We can use bacillocid. Yeah.
Yes, we also use this bacillocid solution to clean the embrace warmer, ma'am.
Yeah.
Then Dr. Sindhu ma'am is asking, what is your opinion on using commercially available wet wipes as you see in the few NICU? Is it recommended just for cleaning the nappies and all? So wet wipes,
alcohol wipes,
lot of wet wipes.
No, we're not recommended. They're not required actually. It's not recommended. No.
Actually, there is no study, so I don't think there is any study.
No, it's not. Actually, we can't say it is recommended.
So it is some chemicals also. It may be an irritant to the skin. So we
not recommended. Yeah.
Yes, ma'am. Dr. Krishnan has a doubt. Do the oil message increase the incidence of sepsis in the NICU?
Oil massage has shown to increase the baby's overall outcomes. So some of the oils like sunflower oil, coconut oils, safflower oils, all these are shown to reduce all this infection and all these outcomes. So I don't think it will increase chance of infection if used properly. Oil massage.
Yes, I had a doubt. Actually, this oil is actually what we use is a commercial preparation in the packet what is available. So do we need to disinfect it before using on the baby? How practical it will be? We are just using the...
we are not using oil in our unit, though. We don't have time for that. We're so busy unit. So in our unit, we are not using oils. So I am not sure about how to disinfect and all. So, but I can say that oil, there's no need for disinfection. If you want to use in a term baby or any baby more than 32 weeks, because skin is also mature, it won't be harmful to the baby. That's what I feel.
Yes. So actually, there is no more questions from the audience. So one question from my side regarding the fumigation in the NICU. So in which condition actually you recommended fumigation in the NICU? Because most of the units, fumigation, they are not advising now.
Yeah.
So if you want to advise, then what are the conditions when you should advise? So I request Sridhar sir also to comment regarding the fumigation, because it's very practical problem.
Yeah. Actually, fumigation is not recommended currently. If your housekeeping routine of your NICU is proper, like daily you are doing all the measures which I have discussed, then the need for fumigation doesn't come. But in case, if you think that in our unit also, sometimes it happened in a lot of Acinetobacter sepsis, Klebsiella basically. All the 5 babies together had in a unit had the Klebsiella sepsis. So like that, if it comes, then definitely you may have to take the babies out and then fumigate the area. So if there's an outbreak, then only, and if the housekeeping routine is not proper, you know that your housekeeping routine is not proper, because of the busyness of the unit, then you may fumigate not on a regular basis, if and when it required. That's my opinion.
So, Sridhar sir, do you want to comment on fumigation? Because that is an important question that I just wanted to ask.
No, so fumigation, even last year we had one major discussion with HICC and with both adult and pediatric infectious diseases. So as you say now, fumigation is not really recommended.
Yeah.
Only thing is, sometimes some environmental pathogens, like for example, Serratia, which is notorious for actually contaminating the space between tiles and the floor and thing. And if you have an outbreak of things like that, not a GI-derived infection, but something like that, and you're not able to get rid of that, those are one of the few things where, in spite of thorough washing and thorough decontamination of the floors, the walls and the thing, when we are not thinking, then they say fumigation. But otherwise, they said no fumigation. And as Dr. Anita said, EcoShield now has become the thing because it's much more easier. So there's no formalin fumigation.
Yeah.
So I think fumigation is sort of gone out of the thing, unless very, very exceptional circumstances.
Dr. Abhay, we have got 3 more questions actually. So now they have put, can I take that, ma'am? Anita?
Ask me.
Yes, ma'am. Yeah, just do you recommend closed suction ET catheter over open suction for prevention of
There's no advantage. There is no advantage. The studies have shown there is no advantage of closed suction. There is no need.
Okay. So what are the VAP preventive measures you take in the NICU? Dr. Jibak is asking. VAP preventive measures. Ventilator-associated pneumonia preventive. Ventilator-associated pneumonia preventive measures.
VAP preventive measures. So VAP preventive measures, you have to make sure that your humidification chamber, the water has to be, changed every daily. Then the tubings, the ventilator tubings also has to be kept in the position that the anti-gravity measures has to be taken, so that gravity pulling of secretions has to be prevented. And then ET tube also has to be fixed in such a way that, the secretions and all should not go down. So all those measures, plus anytime you touch the baby, continue the aseptic precautions with the VAP bundle care approach. We can definitely help the baby to, prevent the VAP developing. Yeah.
Another question is regarding the cleaning of the laminar flow system.
Yeah.
Dr.
Daily.
Asking how to
clean it.
How to clean it, the laminar
We
flow.
clean it with the bacillocin. Yeah. Done?
Thank you so much, ma'am. These are all the questions that we had. So thank you so much.
Thank you. Over to Dr. Sridhar. We have crossed our time.
Yes.
Yeah.
Thank you, Dr. Anita.
Thank you, sir.
Thank you so much.
Thanks a lot. I think it went on for a long time. I just wanted to make one announcement for those of you who are still here. So the Friday, the last talk will actually be now by Dr. Ramesh Agarwal. That is the talk which was actually postponed. It will be Know Your Antibiotics and Rational Antibiotic Therapy. So please do join. Thanks again to everybody. Thanks, Dr. Anita.
Thank you, sir. Yeah, thank you.
Thank you so much.
Good night. Good night.
Thanks, Abhi. Yeah, for coordinating.